Rishi, welcome to the Yellow Couch.
Thank you.
How does it feel to be here?
Amazing, finally on the Yellow Couch,
Yeah.
the world famous.
Yeah, I've been chasing you for a while. I'm glad we could finally make this happen. So thank you for taking the time.
Thank you for having me.
I wanted you on the Yellow Couch specifically because of your experience in two areas. One is the UX design field, which both of us were a part of in the early parts of our career. The second is your experience in the healthcare industry. And I think the convergence of those two is a really interesting topic because of how much scope there is for improving patient experience, doctor experience. I think experience as a whole around everything to do with healthcare. I think there's a massive amount of opportunity there. So today, I just really wanted to get your views and opinions, having been worked in that convergence for so long. You know, your hacks for working in this area and the things that you can tell us about what's coming in the future. So I'm going to use this iPad as a reference so that I have a sense of the flow of this conversation.
Sure.
I guess I'll jump right in, Rishi, and I'm going to ask you, I mean, the first, 8 to 10 years of your career, you were doing pure play UX design consulting. So it was across domains. And then you went on to the healthcare side of things. What was the difference in your first part and then just healthcare focus?
It takes me back 10 years ago when I started purely in healthcare. And honestly, I think all the time we spent in UX particularly, working across the domain, did that foundation because design is all about experience people have in different domains in different areas, right? And that built the foundation that when you apply to certain places, you are able to, understand their challenges very closely and what the problems are. When I started in healthcare, there were a couple of problems. People were very, profoundly people were talking about that. We need to make physicians' life productivity was the main concern. And we were all thinking about productivity is just important. It's a very important aspect that we want to make patient productive. But if you look at the core of it, right, in the healthcare particularly, all the use cases talk about the safety is the most important aspect.
Safety is the most important.
Because whatever you do in healthcare, the context of applying the UX is very different.
The consequences are big.
Very big, very huge.
It's a life and death consequence.
Exactly. So when you apply the UX principles on all the journey scenarios for physicians and all of them, it's not about digital experience. It's about end of it that the care delivery to a person who is suffering.
Would it be safe to say that for the first part of your journey you were doing just UX, and for the second part it was mission critical UX, where the consequences of being wrong are too big?
Too high. Very high.
Right, because somebody could die.
Imagine that you design an interface and where the information is read incorrectly by the nurse, or by the physician, right? In India, you know that only two people can understand each other, the physician and the pharmacist, what they write on the prescription.
My God, yes.
Right?
Yeah, that's so dangerous.
Right. So it can be life-threatening to somebody. Patient cannot read the exact dose, what dose they have to take. What frequency I have to take, right? Or the administration of the particular injection to a patient, if that is incorrect. All of that comes into picture. So I think those nuances blown me away that, whatever you contribute from the experience perspective, if you look at the end of it, the impact is huge.
The impact is huge.
Impact is huge.
So was your work largely in India? Was it abroad?
Well, Citius Tech largely works in the US as a primary market, right? So we worked in US, we worked in UAE for some time, but primarily US is our market, which is a very mature market when it comes to healthcare because it's a very well governed, regulated, and all the systems been in the place for very long. So yes, my primary experience has been the US market, but healthcare is...
When you compare healthcare as a designer in the healthcare space, healthcare landscape in India versus the US, what is your big picture analysis?
It's a very good question actually. In the US, like the way other industry were catching up and all, healthcare made the similar mistakes, right? But it was quite mature, the system was getting in place and also now you have to get into and improvise it, right? And then make it more patient-centric or physician-centric. In India, the systems are still not in place. And as a geography and as a population, we are way different from what the US market
so
is.
very heterogeneous.
Very different, right? In terms of the way we are set up, the way the way we look at healthcare and socially, right?
Okay.
Versus what they look at in the healthcare in the US, it's very different. So that model is, of course.
What do you mean socially?
Like in India, anything happens, it's all about first find out the remedies in house.
Okay.
And you ask your relatives and all of that. In US, it doesn't like that.
You ask your grandmother.
You ask your grandmother, and most of the things you find out, you eat this, you do that, and it will be okay. Most time we are okay with that. But the US is a very different market from that point of view, right? The way people are socially, interact with each other, social fabric goes. So that is a very different thing. So that informs their systems, the way they handle it in terms of regulations and all. I think when you translate to India, a lot of mistakes which will happen, we can of course avoid it completely, right? Like having a siloed systems and all of that, have a more unified
systems
system.
that talk to each other.
Very, very
When
important.
did that happen in the US?
So I think it started 30, 40 years
So
from
does
the-
everyone have like one, so is everything linked to your SSN, or what's
Well,
the unique ID through which?
SSN is one, right? But you also get MRN is created, your medical representative
so
numbers.
you get
and all.
like one medical ID.
Yes. And that is a big problem that they, all the systems are very different. They don't talk to each other. Even as a patient, I don't own my own data. So if I have to get it, then I'll have to get it from one system to other system. If I want to, if I move from one city to other city, from one hospital to other hospital, I will have to, do all of these exercises, and then system has to talk because I may have my medical history or right from my
So
childhood.
this is in the US, you're saying?
This is in the US.
They still don't have a nationwide, holistic, integrated system?
No, because all the
So if I'm moving from one state to another state, I'll have to actually do effort to move my data.
Everything in US is governed through your insurance, right? If you're going to a state where the preferred doctor or the hospital which is in the close vicinity is not part of that network, then you have to get care which is out of network, right?
Yeah.
So there are a lot of these nuances that your entire thing is governed, which policy, which insurance provider you are associated with, and then their network, how the network is covering you. Even and then, if you want to go outside, then either you'll have to pay from out of your pocket and all of that, or you'll have to take your data to the other entity and all, which is a very big problem, and that's a core of the problem, because which is what interoperability is what is called is a big challenge there.
So India is trying to do this Aadhaar ID. What do you think about that?
No, I think see, one thing would be sure that it will make things lives very easy for the folks, right? And I think if you learn from those what people might have made mistake there, right? That unified approach there. So imagine in a remote village, if somebody has some cancer or something like that, and they want to come to Bombay or Delhi to a big hospital like Tata Memorial and all. If their data can directly be transported there, it will be like amazing.
So do you have an Aadhaar ID? How do you get it?
I don't have it yet. No. I think government is just starting. That.
How long do you think it will take to actually become like an Aadhaar?
See, Aadhaar was a revolution in itself, and it happened in not like 5 years.
That took time.
But it was very fast and covered.
Once it kind of caught on, then it was pretty fast.
Now look at our banking, UPI and all. It's all Aadhaar driven. You can open your account.
So are you saying Aadhaar could do to healthcare what UPI did to digital payments?
Exactly. Chances are huge, and I think that's what we should be. We might be leading towards, and that makes sense as well. But again, coming back to some of the nuances of our own things, that you can buy medicines from your without any prescription and all of that. So those I think will still be available to folks, so that some of the things are because we are very big company. We are very big as a country, right? We cannot wait for days or months for the doctor to write me prescription to buy a particular medicine, right? That will be like break everything, and it's very painful, right? Imagine if you have a cold or headache and you can't get a medicine just because you don't have prescription for a day or two. You will be suffering for 2 days without medication, right? That is something we can't afford as a society, right? So those aspects need to be built in, and I'm pretty sure that agencies and smart folks who are working behind it would keep that in mind, and that's where that experience part of it will play a big role. That you are involving the people, the users, and the citizens in the process, so that you make it more contextual for them.
So would it be safe to say that the digital transformation of healthcare in India is just starting now?
I think we're learning from Aadhaar, our unification,
our successes
with the pen
in UPI
and all of that, and all of these things play a very big role. See, still a lot of people don't have PAN card, right?
Yeah.
A lot of people don't have it, but that's why they went to Aadhaar. Now this Aadhaar number will be more available to the folks, right? So that should make a lot of difference.
When you started doing UX in healthcare, was there a difference in the process, in the design process?
I think overall as a process might remain same, right? You do the research and all, but when application of it, nuances are very different, right? In other areas where you are talking about delightful experience, persuasion, engagement, your choices in healthcare are more about identify where the chances of potential risk and errors going to happen, right? Yeah. Because I want to make sure that those loopholes
so
are
the goals
covered.
are different.
Goals are very different, right? Because those loopholes for the patient, for the caregiver, for the anybody in the ecosystem must be covered. Imagine that somebody who's doing just the claim reimbursement, just settling your claim. If your claim get delayed, your surgery can get delayed.
Yeah.
The person can be in pain for days.
Wow.
That is a huge impact. So I think that empathetic approach, which is UX is always about, that you need to
really
understand.
Gets exaggerated here.
Exactly. I mean, imagine that you get a headache or cold. People are in healthcare space are working below their normal cognitive abilities. So digital interfaces, what you're designing for them, assume there is an accessibility challenge there. Because remember the day when you had a headache, how challenging it has been. You can't even do your normal stuff. You can't take some decisions and all of that. Now you're designing interfaces or whatever digital touch point for people like them. So you have to be extra careful about understanding. Imagine somebody has fracture in hand. How are they going to use mobile phone?
Wow. So accessibility challenges are higher.
And in healthcare, temporal accessibility is even bigger problem. Something could be inaccessible because of your condition. So you have to be very, very, aligned with that.
Interesting.
So I'll give you an example. So we were doing a research for one of our recent projects we were working on. Small mobile app device as a companion app. So patient has the POC, portable oxygen concentrator, right? And for the 65 years above, of course, those kind of people have the COPD disease and all. So we were interviewing, and one of the users didn't turn up. We called and we checked that you were supposed to come. We attended this discussion.
Yeah.
There was a wildfire in the US in his region.
Oh my God.
And he says that I cannot come because my doctor said no. Because if I come out, I cannot breathe.
I can't breathe, yeah.
And my machine will go bad because of the pollution. These kind of nuances.
Wow.
Now this is restricted that person in house. Now when you think about patient journey and all, that has to go in digital experience, which probably telling the users about what your atmospheric conditions like. You have to be careful about your all the equipments in the machine, which is filters and everything, so they are all up to date. Because imagine you can't breathe for half an hour, what would happen? It would be very traumatic.
So I would assume that when you would do a design recommendation for a healthcare system, is it tougher to get those things implemented and see them go live because healthcare tends to change very slowly and there are so many things to comply with? Unlike, let's say, any other kind of industry where I do a digital transformation, it's likely to maybe move faster. Is that a safe assumption?
It's a very interesting thing actually, In healthcare, you are working on the verge of innovation because most of the innovation get applied to military or healthcare. May not be at the digital front, right? But anything related to your scanning, your equipments which is getting implanted and everything about in healthcare or military, right? So at the one side of it, when you look at the equipments and technology, the applications is a gigabyte speed race. But when it comes to the digital ecosystem, because of the siloed nature of these different systems.
Such a paradox.
Exactly.
So really innovative, but laggard in digital.
Exactly.
How is that even possible?
Because when healthcare was always at the speed of implementing these equipment like MRI machines and all of that, to get the healthcare sorted. But I think they missed the end patient into the game. That how should we look at that? So that's the variation in speed is where the challenge is. So you have to bring that also in line so that now satisfaction and then whole ecosystem works in hand together. Because this problem of siloed is because that you never considered these scenarios. which is what.
So I see three areas where innovation, like you said, is kind of trying to push the envelope. One is defense, military, as you said. Second is medical science, right? Because there is an inherent motivation for human beings to want to live longer, live better lives. And the third, I would say, is competitive sports.
Yeah.
Because it's all about beating the other person, even with the smallest.
Yeah.
Like if you see innovation in F1, small changes in your car can mean the difference between winning and losing. But it's such an interesting point you make, right? Even though you might be in an industry which is always on the bleeding edge or the cutting edge of innovation, that doesn't mean that digitally they will be ahead.
You're mature enough, right? Yeah.
Wow.
That's quite evident, right? The way the people struggle and all of that, right?
Yeah. Because, I mean, the machines, etc., in the surgery room or in the, where you get your tests done, they're also advanced.
Yeah.
But when you go to the doctor's OPD, he's still with a pen and paper.
Exactly. So, imagine the patient, to take care of their health, right? They have 5-6 digital interfaces to deal with. There's a patient portal, which has the clinical data. There's a member portal, which has your insurance data.
Yeah.
There could be some wellness app, which is all about how do you keep healthy. There could be, remote telehealth, which is where you converse your doctor, which may not be integrated with your clinical system and all, right? So you have easily 4 or 5 apps in your probably mobile or thing which you have to deal with. Why can't that be unified? So that you have a consistent experience across your journey.
I recently had a hospitalization experience for a close family, as I was the primary caregiver and I had no digital interface to tell me what's going on, keep me posted, give me a platform to ask questions. I mean, it was so archaic that you would sit in the waiting room and a guard would come and physically call you. So if you are downstairs in the canteen having a chai, there is no way you would know that you're being called in the ICU. It's just no-brainer that you should have a little interface that sends you a little alert.
Yeah.
And why does a watchman have to come and find you in 2024 in a good private hospital? It just boggles my mind.
And that experience you're talking about, I think you will relate well that how traumatic it is to be lived through that experience for an individual. So that's what my point was, that in other areas when we are designing for delight and engagement, here the choices are very different. You are just waiting for one alert.
Wow.
One alert.
In fact, people's expectations are also so low.
Very basic.
Talking about delight seems a bit out of place here.
Exactly.
I'm like, we'll get to delight, man. Yeah. Let's just get the basics.
See, even when I'm doing the research, let's say this context, if I do research, would that be delightful for that you get an alert? You'll say, what delight?
Actually, man? You can't even call it delight.
You can't even call it delight. So your earlier question that how the research, how this process changes, the application of it changes that how you deal with this kind of situation and how observant you have to be.
The emotions are so different.
So different. Yeah. So, see, alert, when it comes to your Amazon packet delivered, you even don't care. Oh, wow. Okay, fine.
Wow.
But here you're waiting for that alert. Tell me what's happening, what's not happening. You're still that,
you're constantly looking at your phone.
20 years back, the way you used
to wait for that one phone call.
Yeah. Now you're still waiting for that to happen. That's the difference.
That's crazy.
That's the difference of experience of people still have in this mature digital world. In healthcare.
Because the minute you go into the hospital environment, your emotional landscape completely changes, right? As an individual, as a patient, as a caregiver.
That's why I said that cognitive abilities of the people
are
physically
already
and mentally
80% lower.
Are already down. So that's where the safety and error-prone situations become more prone, because now in that you are not.
You're anxious, you're upset, you're tired, maybe you haven't even slept. Are there some myths and misconceptions about doing design work in healthcare that you have encountered talking to people or having worked in this area? People assume it should be like this, but then you have to kind of enlighten them on. One such was high on innovation,
right.
low on digitization.
Exactly. I mean, one very common is like good design means jazzy visual and all of that, which is still in healthcare.
That's
right?
one,
which
definitely number one on the list.
Will remain there.
UX in healthcare is not about making pretty pictures.
Exactly. So this imagine an app which I'm creating I can easily apply translucent images and nice and all. But when I look at the safety aspect, the font has to be big. I should show only 2 data points to the user. What is your oxygen flow? What is your your breathing rate? That's it.
When clients give briefs, right? And you've heard this, Rishi, I'm sure, right? I want wow.
I want wow.
You can't translate that in healthcare to mean beautiful, fancy, jazzy.
I don't deny that it can't be soothing.
It shouldn't look ugly.
But the primary thing is it has to work for the reason it is supposed to be there. That has to be satisfied. Then you do on top of it whatever you want, right? You can't compromise that aspect. And if that is your priority, then of course everything else. But you have to convince folks around that. And now I think the people are getting mature about this and understand the context and all much better.
You've done projects in India, healthcare projects?
No, not really. In healthcare, not in India, but US a lot.
Yeah. So, what do you think would be the difference in?
I don't think that we should be, in terms of stakeholder expectations and all. I don't think that because people are quite mature now. They're using the same iPhone and all. People have grown up from all of that ask. But these questions will always come up. They still come up. I think you are doing a lot of consultancy nowadays.
I can write a book.
Prioritization.
On this word called wow and what it means, right? There is no debate on what wow means in healthcare, like you said, right? It means it should work.
That's what, whoever we onboard on our team, we tell that safety first. Safety first is your motto, right? Then everything else would happen, but you can't compromise on that aspect for sure.
Let me ask you about one more misconception that obviously we have heard in UX a lot. Everything should be done in 3 clicks. What do you think about that in healthcare context?
Okay, I'll give an example on this. So imagine we are, actually not imagine, we were doing this, right, project. So patient referral. So physician supposed to refer the patient to another specialist. Specialist for the certain things, right? You create an app, which is easy click. On a swipe, you can send a patient to the specialist.
One click,
right?
Oh,
possible?
God.
Doable? Very
it's
easy.
Possible, yes.
Very easy.
Yes.
If you look at the whole ecosystem, you will create a havoc in that.
Why?
Because the specialist is a specialist. They should be taking care of very critical patients.
Oh.
If you just by your digital experience, you made it 1 click instead of they sending one patient to that which is most critical and should be attended by the specialist. They end up sending 3. They will clog their calendar.
And every patient will suffer.
Every patient will suffer. The person who is supposed to get the treatment will not get it, and then it will go haywire.
Wow.
Yes, 1 click is yes, but it has to be contextualized to those tasks and all where it should be applied.
So sometimes reducing clicks is actually bad.
Yeah. It's required.
So it's very subjective.
It's very subjective.
Sometimes more clicks is good because you are trying to ensure that people have gone through the due diligence and all the required steps before making the decision.
Yeah, when as a physician, you're putting your dosage for injection to a patient, make that the biggest font to make sure that, because it's a dot, 1 decimal, 2 decimal, things can change, right?
I was talking to my uncle who's a doctor, and he told me that there is a pretty high percentage of patients who suffer because of mismanagement. And I think, in my view, mismanagement is never intentional. I think it's a design problem.
Exactly.
Right? It's a design problem. It's a combination of all these things.
Exactly.
Poor system design, bad choice of fonts, poorly written copy.
Very basic.
Reliance on memory. I mean, I've heard stories about somebody in a hospital and the nurse came and gave medicine to take, and the patient is like, I just took it. And she's like, oh, acha, sorry.
Right.
Oh. I mean, what if he had taken that dose again? So the amount of things that are just being reliant on someone's memory is scary.
Exactly.
Honestly.
Again, digital experience in healthcare context particularly, right? You have to not think about just the digital experience. You have to think about that whatever I'm designing is a tool I'm giving in the hand of physician or a nurse to deliver care. Imagine a doctor without stethoscope, with an iPhone in hand now, in future. Because you will have all the wearable devices on you.
Yeah.
I can see your heart rate, oxygen rate, everything on my mobile.
Oh.
I don't need to, touch and do that kind of checkup probably because of those wearable devices which are going to be in future very normal and real, right? So in those scenarios, if the point you're making, right, if that's not correct, digital experience is all about, it's a tool to deliver.
Or the data might be correct, but you're reading it wrong.
No,
You're
because-
inferring the wrong conclusions from it.
Right.
Or you're not focusing on the stuff that is important.
Exactly.
You miss out.
Right.
Which is what happens in poor data visualization.
And an interesting part in healthcare is that you should not be looking at it, because the healthcare is all about
the
touch,
patient.
your relationship with the patient. So you should not be looking at it. It's a tool, right? You have to give care.
So the tool should allow me to focus more on the patient, and less on the tool.
Exactly. Because if you make something, wow, this nice looking interface, and you get engrossed in that, somebody else would suffer, right? So those are also important thing, that okay, this is just a tool. It's not the solution completely, right? The solution is out there.
What are some of the recent trends or innovations that you've seen in UX design in the healthcare industry? I mean, you working in the US market, it's such a mature area. What are some of the things that you are excited about?
See, I'm honestly very excited about the possibilities the Gen AI would create.
Oh,
because,
Gen AI.
Yeah, because it has a potential to converge everything what we are thinking in the siloed system into one area if it is implemented well. Imagine that design folks who are part of the ecosystem create tools with Gen AI which can create healthcare more personalized. So when you are taking the same medicine which I am taking over the counter, but the doses are very different, which Gen AI can inform. So you have to take half a pill and I have to take a full pill, whatever it might be, right? So healthcare can be very personalized with Gen AI thing, right? In healthcare, we are all, to care is to be delivered, right? Now what it can predict, what can happen, how the condition can
go.
go.
So predictability goes high.
Right. And that, if you link it with your wearable technologies nowadays, which is coming up, like, simple in COVID, that O2 became so popular, right? That measure your oxygen level, That's a wearable device. If your wearable devices are connected.
Or the sugar patch.
Anything. Sugar patch, BP monitors, which are all Bluetooth connected, all Wi-Fi connected in your home and all. Your physician, your care team can see how you're performing, and they can alert you in advance. Sit down, your BP is going high, chances of
I still haven't seen that one big mass adopted healthcare wearable that is like the next big thing. Is that coming anytime soon?
That's what I'm saying, that now with Gen AI and this, see, the whole problem is that siloed system, right? Which is what blocks everything. Plus, there is a very important aspect is about regulation. HIPAA and your personal data and everything, compliance around that doesn't allow you to the way you can interact with the data and all of that. So that is also, you have to respect that, because nowadays with all this fraud and everything, your data gets stolen, and then your healthcare data which is out, that can be challenged. So I think that has to be mitigated. So all of that, but these trends can have a real potential around that.
Wow.
For sure.
Wow. Are there certain opportunities that you feel are kind of missed opportunities in improving healthcare across the world that people are not looking at, like areas that you feel like nobody's really kind of paying attention?
The way I've seen so far, right, I think most of the healthcare is invested into care delivery. I think what opportunity we might have missed over the years now is that keeping people healthy.
Oh, preventive.
We have to keep, we are investing heavily in technology.
But there's so many fitness apps and, a million fitness apps. None of them work.
None of them work, right? And even medically, right? Clinically. How do if you put a lot of effort around that through the system, by keeping people healthy, I think it's a lot of cost saving alone, and avoid a lot of suffering as well.
So if Rishi, you were to ever create a healthcare solution, it would be more in the preventive area?
Talking about the missed opportunity, right? That's where the thing is, right?
Wow.
How can I keep person healthy? How can I avoid them getting into serious situation? How can I keep them outside? And that's in favor of everybody. First of all, as an individual, you are not suffering, because the suffering in healthcare is personal, is physical.
It is.
Right? That is one biggest achievement. Second is then your entire ecosystem is not pressured to take care of your illness. Then I can take care of the critical situation.
Have you heard of this new area called digital therapeutics? So it's like therapeutics that are delivered digitally, which can even get FDA approvals, right? So We recently built a digital therapeutic for a startup that is trying to help terminally ill cancer patients manage cancer through this. So this is an app essentially that runs them through a fixed duration program.
Okay.
And it involves behavioral therapy, Eastern philosophy, Western, tools to help people, manage their cancer and even maybe get better at a stretch. And what I was really surprised to hear when I was speaking to the founder is that their whole goal was to get FDA approval, so that what that really means is your doctor will prescribe you an app just like they would prescribe you medicine.
Yeah.
That for me was quite mind-boggling.
Yeah. Software as medical device, SAMD, is quite popular.
Software as a medical device,
exactly.
in a
So,
sense.
yeah, that's exactly the point, that you can't manage the condition well through app, right? And now there's a second app they have to download in their system, right?
That's
it's
true.
because it's not, whole unified
So
experience.
it's just one integrated, unified, holistic system.
Exactly.
That is not siloed.
Exactly.
That connects all the dots.
Because now to manage my condition, I have this app, and then I had already had my patient portal.
For
and
prevention, I have something else. For something else,
Exactly.
That's actually so true.
And then imagine the patient like them. It's very difficult for them.
Yeah.
And we know that most of the population is aging population. So they are digitally, nowadays they are digitally quite well. They are very well educated about digital things, but still not probably as youngsters and all them. So for them to have
That's true, man.
And our ecosystem could be even challenging, right?
So we're almost at the end, Rishi. I want to ask you a question from a segment we call Unpopular Opinion. Okay. What is the one thing that you consider as a fact that most people disagree with you on, especially when it relates to designing for healthcare?
I'll go back to that discussion, that the wow thing is always good-looking stuff, and you always need convincing with a lot of
even in the healthcare industry.
Even in the healthcare, that's not the case. Which is not even like clients and all. Entire ecosystem is like that, which is changing now that people are talking about consumer-grade experience in healthcare. But I think this one is also very important, which is misunderstood. Consumer-grade experience doesn't mean that consumerism.
Wow.
Which is consumer-grade experience means that involving the people in the game, so that you design, experience for them. But because the word consumer, people think, okay, it has to be like Netflix. It has to be like.
So it has to be like Netflix.
Yeah,
Wow.
which is not consumerism. Consumerism means you have to respect.
Consumer-friendly and consumerism
is two different things.
Two different things.
But unfortunately, consumerism is all about, has roots into commercialism. Which can be very well misunderstood. And that's a trend now in healthcare, that a lot of talent is coming from the consumer world, like eBay or Amazon or your Netflix and those kind of areas, which is good.
Yeah,
because
on one side it's good because they bring with them that expectation of ease of use,
but
simplicity.
I'm just kind of wary about that. That should not get into that commercial. More
the pitfall around delight, engagement, rather than error prevention, safety, care delivery.
That should not get overshadowed. So that is something probably very difficult to convince, and I'm very skeptical about that aspect.
Well, I hope you make that unpopular opinion an popular one. And on that note, I want to thank you, Rishi.
Maybe the yellow couch should help in that.
That's our job, man. Thank you so much for coming.
Thank you very much for having me. Pleasure.
My pleasure.
Yeah.